Hey guys, I am back. This is the first video I am recording of the new year, so, prepare for me to screw up and say 2024 1,000 times if we need to say dates. But anyway, how you guys doing? I hope you're having a fantastic new year. Sorry, I had to pick this guy up. I just noticed he was sitting on the floor. That's not cool. So we're back with Medic Box. I'm excited. We're continuing. We're in what? We're in phase 2? Or box 2? No, phase 2. Phase 2 vehicle. This is box 2. Box 2, phase 2. So moving right along, I had found, I had gotten a much more humorous patch to put on this, and for the life of me, I don't know where it is, and for the life of me, I don't know why I didn't just slap it on there as soon as I got it. That was bad thinking on my part, but there's lots of bad thinking on my part on this channel. So anyway, I hope you guys are having a fantastic new year. And everybody's doing great so far. Let's get into Medic Box and see what we've got for January 2025. Okay, I got it right. Fantastic then. I'm really enjoying this box. This subscription so far. I hope you guys are. Did I not cut it all the way? There we go. So this is the Pro level, MechBox Pro. This is, but now remember, this is vehicle-related stuff. This box, it is vehicle. Is this a nasal? Ugh. And a box for Peter Kitty Cat. Terrible stories from medic school about nasal stuff. So all sorts of new stat and a rescue hook. All right, so. Of course, before we get into the stuff,
stations, all stations, we have medical items in the box. I repeat, medical items.
Better get the old man down here.
President's in his limousine. They're diverting to Andrews. The vice president is out of position, and the chairman of the Joint Chiefs is on his way.
Rush priority traffic. We are now at DEFCON 3. Incoming medical rant.
You guys getting sick of that yet? All right. So, let's see. Let's separate everything out. So, phase 2 of the vehicle trauma kit. Here we are. We're at phase 2. So it's box number 5 overall of Medic Box. But we are in, so this is different that they're changing this, because it used to be box 1, 2, and 3, of each one. So we're done with our duty IFAC. Duty. We are in box 5, which is phase 2, box 2. So we've got 1, 2, 3, 4, 5, 6, 7 items, and then we've got 2 Pro items in here. So let me separate the Pro items. We'll look at them separately, and we'll just look at what goes into the kit itself right now. Now, these are the 2 Pro items from the last box. And then we'll put everything into our vehicle kit when we're all done. So, 1 dose. 3-er, 4, 55, this guy, yep, and did I miss something? No, I threw this guy over there already. Yeah, all right, everything's fine. All right, everything's fine, we got everything. All right, so we're gonna start with the Visor Rescue Tool. Supervisor XT by Stat Gear. I'm pretty sure we've seen this before on the channel, but we're seeing it again here. So now does this have a place? This doesn't have a place in the bag, because this goes in your car. So this is a multi-purpose kind of deal. So this can like a carbide glass breaker. This is to get you out of a car, or it could get you into another car, you know, to rescue somebody. It's got a nice soft grip. It has a nice soft rubbery grip, and it actually is pretty. It's pretty ergonomically designed. You see, you put your 2 fingers in, and then go ahead and make the jokes. Go ahead, do it. Put your 2 fingers in, and then it's got the little nub over there to rest your whatever finger. What do they call this one? Index finger, the finger. What is that? I don't know. So you can, or you know, reverse grip like that. I probably wouldn't do it like that. But so anyway, you've got a really good grip to break a window. Now, so you'll find that when you are trying to break a window, and usually what you're going to be doing is, if you're rescuing somebody, you're probably going to be breaking most likely the driver's side window. There's a sweet spot right in the corner. You hit that, and the whole window shatters and falls out. Then you have a little line cutter here. Well, I mean, in this case, it's just a seatbelt cutter to free them from it. And by the way, it works for you too. So I say them as in rescuing somebody, but for you, if you find the need to rescue yourself, I always look at it because of my background as a rescue tool to go rescue other people, but it works for you too. So good to have. This is, you know, I have very mixed feelings about Stat Gear stuff. They've got one knife I really like, and then a bunch of stuff I don't, but this is actually a pretty good tool. And then this, you can just strap it to your car visor. And then this is elasticy, and so it fits just about any visor. And you have this just kind of quick access kind of thing. Do you have to put it on a visor? No, you don't. If you can strap it somewhere else in your car, great. Next, we've got a fire blanket. Why a fire blanket? This might not, some of you are going to say that's very intuitive. Great, a fire blanket for the car. Cars do catch on fire. They do. And not always from the reasons you might think. And they just, I'm going to leave it at that. So this, I'm opening it slowly, but what this is designed to do is these little pull handles, they would just, you would just pull these and this blanket would come out. This is designed to just smother. This is like a Nomex type. I don't know exactly what it's made of. I don't know what it's made of, but when I say Nomex type, it's, does it say right here? No, it doesn't. We actually had, so I've talked about our little green airdroppable, you know, forward control things that we used in the Air Force. We call them the operations modules. We had to have these fire blankets, bigger ones than this, but we had to have them in there because anytime you have anything electric, you know, the chance for fire is in there. So we had these exact same things almost. So what this does is, if there is, so typically this is for a person. If a person catches on fire, really, you use it for them. But you could also, you could use this to smother a regular fire. But I mean, this is really for, I would use this for a person. Let's say anything's on fire, whatever. This is designed to smother that fire. It is a fire resistant material, fireproof material. I've said this before, when you're dealing with fire, fire needs 3 things to burn. It needs heat, it needs oxygen, and it needs fuel. And you take any one of those 3 things out of the equation and you no longer have a fire. So by smothering the fire, you're taking away that oxygen source. Now, when I say oxygen, it doesn't need to be straight oxygen. Remember, there's oxygen in the air that we're breathing. So you smother the fire, you take away its ability to draw oxygen from the air. You're also reducing that heat, because as the flame goes out, it cools down a little bit. Now there have been times, you know, you will see, you smother a fire. If you just smother it and then take the blanket right off, it could reignite, because it is still hot. And if it's hot enough, and then you take the blanket off and air goes back in, that could reignite the flame. So you don't just like smother it and, oh, the fire's out, and you take it off. You leave it on. And it would be pretty stupid for you to reach in and then take it off anyway. You just sort of, I don't want to unfold it because, you know, my issues with refolding things, you know, getting them to fit nicely. But you put it on. You're not going to be like with your hands in, like, oh, like reaching in to put it. You throw it on there, right? And just get it on there. This also has some weight to it too, so you can kind of toss it nicely. You're not like trying to reach in and tuck the fire in and tell the bedtime story. You know what I mean? You know what I mean? Okay. This also is, though, if somebody is on fire, you can wrap them. You can wrap them up in this very nicely. This is they make them much bigger than this as well, and this will not help their burns, but it will put out the fire. So this is actually, we've gotten these in a few different boxes. This is a 40 by 40 inch. We've gotten smaller ones, but oh, it says fiberglass right there. Smells plasticky. I like it. But the smell is probably from sitting in this. Yeah, not the fiberglass itself. These are good to have. They're not bad to have around the house either. For like, not a grease fire, because if you throw it on burning grease, you're gonna splash burning grease around. But for other basic things. So, this is another one that I don't think this is going to like go into the bag, but this is just going to sit in your car. So, like I said, you just pull these and it comes down. Okay. Number 3, hemostatic gauze. We've talked a lot about that. Sorry, quick water break. Hemostatic gauze. So there is just one of these, and it is small. I guess you're not putting together a whole field medical kit, but so I've given you the definition of hemostatic before, and I'll give it to you again. Hemo means blood. Static, fucking stop it. Hemostatic stops bleeding. And so these usually have, not usually, they always have some kind of agent in them that causes a clot that stops bleeding. And I've told you these stories before, and I'll tell it again because somebody might not have heard them. The original ones, the old ones that we had in the military going into Iraq in 2003 and Afghanistan in 2001 and everything, they were made to react with the, I'm using a brand name, but I don't mean the brand name, but like the original old quick clots. And I'm only using that brand name to give you a reference. I'm not saying that brand, but it was a powder that you would rip open and you'd pour on a wound. It reacted with liquid to form an artificial kind of clot, and it would react with any liquid, any at all. And so in the early days, you had medics or just any other troops that had access to it, you know, with their hands full, ripping it open with their teeth, or just ripping it open willy-nilly and letting the stuff fly around in the air. And there is liquid in your mouth. There is liquid in your nose. When I say liquid, I also mean the mucous membranes, inside, the body, the moist cavities, in your body. There's liquid in your eyes. And you had some people giving themselves some real serious problems as that stuff would get into those places it wasn't supposed to be. The new stuff is totally safe. The new stuff interacts with actual stuff in the blood. So you don't have those problems. What you do have a problem with is once you put this stuff on, and if you've taken any first aid course, they tell you don't take stuff off. Once you put a dressing on, you can always pile more stuff on. You don't ever take stuff off. So especially this, once it has started creating the clotting action, if you rip this stuff off, you're ripping that clot off, and it's like when you plug up something under pressure and then you rip that plug out. It's even worse of a break in the dam or whatever. So this stuff is great, as long as you just are aware of a couple little things about using it. So that's very cool to have. This does go into our pack. So let's open this up. I'm so glad that I got taught to look at the picture. I mean, oh, I forgot. We have to unstrap this. And where in our magical mystery kit does it go? It goes right up here. Okay. Hemostatic gauze, check. Moving right along, we've got a nasal airway. Oh, it's pre-lubricated, thank God. So a nasal airway. The reason we have this water break, hold on. Now, short of intubating someone, which we're not doing, because you're not qualified to do that. Maybe some of you are, I don't know, I shouldn't judge. But do you carry the equipment around with you to do it? There's two different airways that you can put in somebody, for trauma type things. There's the oral and the nasal. It takes a little bit of training and skill to get the oral airway in. You need to do some measuring with this also, but I guess you're just assuming it's the 28. Let's just say that the nasal airway is a little bit easier and a little bit safer. Oh no, this says measure fit from tip to tip, but you know what? You only have one size anyway. So, okay. Yeah, there is some. Never mind everything I just said, because you know what? They even tell you have to measure this. There's different measurings from. We used to measure, regarding the ear and everything. Anyway, all right, I'm not going to get into it. So, in any case, what you're doing is you're establishing an airway, especially if there's blood and other fluids, that could obstruct the airway. You want to just what we call a patent airway, where you can get air in and out. The nasal one obviously goes through the nose. We used to call these nasal trumpets, and you lube it up with an actual water-based lubricant that Surgilube. That's the one we used to carry. And it's inserted in the nose, and it goes down through the nose, as you can see, into the airway. Now, intubation, since I brought it up, that's when we use a laryngoscope, and paramedics can do this. And you see it on ER shows all the time, where they put, it's got a handle, and it's got a metal part that comes out, and they put it down into the patient's larynx. And then you slide a tube that actually goes into the upper airway, and then you inflate a little balloon to hold it in, and that's a whole different procedure. That's almost like it's not a minor surgical procedure, but that's an invasive procedure. This is not an invasive procedure. But then you have, an airway. Now, in medic school, this is not pleasant to have done. We actually had to do these on each other, which I don't think you do in civilian medical training. You do it on a dummy. You don't do it on people. But in the Army, we actually had to do it on each other. And it was so not fun. Not at all. But this is, vital life-saving stuff there. So, okay. Where does it go? So yeah, in EMT school, in civilian EMT school, you'll learn actually like the how to properly measure these for size. Now, I'm not bashing on Medic Box for for giving just one size. They're not going to give you the whole range of sizes, because the chances of everybody being trained, as an EMT or a first responder to know exactly how to measure it is pretty slim. You know what I mean? So they're just giving you probably the most common size and letting you have something rather than nothing. Being able to maintain an open airway is the most important part of emergency care. Now, how do they get theirs to fit in there so nicely? They must have just folded it in a little bit. There we go. Okay. All right. Moving on. What's next? We got the nasal airway. No, we've got a cravat. A cravat. The cravat is basically it's a triangle bandage. What this is, I mean, here, look at it. The pictures. This is a multi-purpose thing. You can use this to make a bandage. Remember the difference between a dressing and a bandage? A dressing goes directly on the wound, right? And then a bandage secures it on. You can use this to make a sling. This is a sling. See how it holds that on? And that's a swath that goes around the sling to secure it. If you just put a sling, it's still, that limb can flop around all willy-nilly and cause pain and damage. The swath secures it to the body. You can use this to secure a splint. You can do a lot of different things with this. So a cravat is just it's the physical cloth thing that you can make these different tools out of. Typically, we carry them in a 2-pack because, again, if you're going to make a sling, you have to make a swath with it. So, you'd always have el doso of them because you need to sling it and then swath it. And if you're going to put a splint on, typically you're going to secure that splint in 2 places, not just one. Now, so it's this time I will say, Medic Box, maybe you should include 2 just for those purposes. Maybe not everybody's trained to know exactly how to put that on, but they are giving you the pictures here. So, I don't know. Maybe they just expect you to figure it out, or maybe this is big enough that you can just, I don't know, twirl it all around a splint or whatever. But it definitely is cool to have, and this kind of fabric, I'm just going to say, in like survival stuff, you can use it to make water filters and things like that also. So cool. Cool. Let's see. Number 5 goes where? Number 5, Johnny 5 is alive. They have it rolled up right down here. Never trust Nova Robotics. They will disassemble. Next, burn dressing. So this is basically what you got here is a sterile piece of gauze. And it had, this has tea tree oil, and it is it's got a nice cooling gel with it. So it's a sterile dressing, and it has, this one is, what is it? Tea tree oil, glycerin, propylene glycol, emulsified silicone oil, and purified water. So what that all is, it's like a gel, because you don't want it just water that's going to like run away. We're dealing with burns. The first thing, so the first part of treating a burn is remove the burn, remove them from whatever's burning them, get them away from it. The next thing is to cool the burning surface with something like this. This is designed to help cool, because so when okay, so you're cooking a roast in the oven. You take the roast out of the oven. You removed it from the burning source, from the oven. But anybody that's proficient in cooking knows that roast is still hot and is still, as you take it out of the oven, the reason you take it out a little bit before it's fully done, just a little bit, and you let it rest, is because it's still cooking. It's still got that heat. It doesn't come out of the oven and instantly it's like nothing is, it's done. It's just stopped, right? It's still got that heat source in it because it's been heated in the oven. Burns are the same way. A burning doesn't just stop doing damage because you've taken it away from the heat source. So the second step in treating a burn is once you get them away from the burning source, you cool off that tissue. And that's what something like this does. And then the third step is to, sterilely wrap that area, because burns, because of the massive amount of tissue damage they do and the exposure to underlying tissues, they're very prone to infection. And burns are the most painful kind of thing to treat. I'm not even going to get into it because it just gives me that biting in tinfoil feeling because of... So this gives you a 2-in-1. This allows you to put a sterile dressing on it, but it also lets you put a nice cooling, I can't think of words, a nice cooling element on that burn to help stop that burning process. The other thing is also, with a severe burn, dressings stick to that damaged tissue, and then they have to take them off, and it's incredibly painful. This is made so that it won't stick to the burned tissue, and they can, when they get to the hospital, they can take it off. If you were to put just a regular piece of gauze on a second degree or even third degree, third degree burns, that will stick to the damaged tissue, which is the third degree is just, don't even want to get into it because it just gives me such bad feelings even considering a third degree burn, putting stuff on it. But a second degree burn starts weeping fluid and the stuff sticks to it, but this prevents that. So that's the point of having an actual burn dressing as opposed to just a piece of gauze. And it gives you this little centimeter scale on the bottom because you're going to document the size of the burn. It's important that the hospital... Burns need to be treated in a very specific way. They're terrible, terrible injuries. So this is really good to have. And again, in a car, there's a lot of stuff that could burn. We have responded on the ambulance to people that have no idea what's going on, and they have just pulled over to the side of the road, popped the hood open, and just opened that radiator cap right away, and have gotten scalding third-degree burns. For those of you who aren't familiar, you cannot just open up, your radiator cap. It is under pressure, and it has fluid that has been circulating through your engine at whatever temperature, I'm not sure, but it's fucking hot, and it will spray on you. And chances are you're looking in over the engine, so your arms are right there, your face is right there. Terrible, terrible, awful thing. So it's not just from like a fire that people get these horrible burns dealing with cars. This is excellent to have. So let's put this in our kit. This goes, I guess, in the above aforementioned pouch up here. Hey, in the comments, if anybody knows how hot a car engine actually gets, go ahead and throw that in, because I don't. I honestly don't. And now we have a burn med pack by My Medic. And you know what? Since this is resealable, I'm going to open it. We're going to see what it has in it. Let's see what everything involves here. So, go ahead and eat this. It's delicious. Doesn't say do not eat. So what we got? We've got Super Skin Bandage. We got 2 of them. Look, they're OD green, so I automatically like them. These look like big Band-Aids, to say the truth. Okay. We got gloves. Nitrile gloves. We've already talked about why nitrile is great. We've got... Let's sort it all out. Burn gel. Okay, so this is the same kind of stuff. Remember, we just talked about what's on that dressing. This is the same kind of stuff, although I bet it doesn't have tea tree oil. Purified water, propylene glycol, glycerol, emulsifier, and surfactant. Oh, it does have tea tree oil. All right. I guess tea tree oil is the new stuff. So this can be put, again, cool the burn off, and it feels good too. But if you don't have a burn dressing, you can put this on and then put a dressing over it. It helps, and they give you 3 of them because they're little. All right. What is this? See, what is this? Pain reliever. Acetaminophen. It's Tylenol. Burns hurt. Okay, that's cool. Antiseptic towelette and super hand wipe. So why would they give you these? I'll tell you why, from my point of view. Remember we talked about a burn is an excellent pathway for infection. You're not going to use this on the person. You are not. Because you're just not. It's going to hurt. Oh my God, they're going to scream in pain and punch you in the dick. But if you are going to apply care to them, you want to make sure you are not now a vector for infection. You're not going to, you want to be nice. You want clean hands. Even if you're going to wear gloves, which you should, you want to clean yourself. That's from what I'm thinking. You're not, what's on them is on them. You could wipe down the area around the burn, but that's really not necessary. However, cleaning your own hands before you open up packages of stuff, before you apply first aid to them, prevents you and whatever surface bacteria, whatever you have on yourself, going onto their burned, vulnerable areas is great. And then a super hand wipe, I would use this afterwards, because you're going to have all this stuff on you, potentially gross burn person on you. So, yeah. And then this is, now they don't say it, but we know what this is on this channel. Most of you do. You soak this in water and it becomes a little, not a washcloth, but a little thing. It grows into like a washcloth. Okay, a little washcloth, a little paper towel or something like that. So it's an interesting little burn kit. What I noticed it does not have at all is any kind of dressing. Nothing. I mean, it has these. So we're looking at, very, very small burns, very minor burns in this kit. But that's okay, because they gave us the one big dressing, right? The one big burn dressing, and then this is for, like, I guess, little ones. It's an interesting mix of stuff in here, though. Like, it's almost like they want to prep you for dealing with somebody with, like, a major burn, but they don't give you the stuff for it. I don't know. I think it's like I said, it's a very interesting little mix of stuff. But listen, everything in here is useful. I'm just not sure how they thought that this was. It's good stuff to have in your car kit overall. I'm not complaining about having the stuff, not at all. It's just they do say minor burn. Okay, you know what? I can't complain. It says minor burn kit. I cannot complain about that. Never mind. I mean, I can complain about anything, but I'm not going to. You see, is the thing. It is just for like minor burns, and then you have the big burn dressing for like your major problems. So where does this fit in? 7. It doesn't. I don't see it on the card. Stow these supplies. Oh, in the net. It does. I'm sorry. See? I was told to look at the picture. I was told directly, look at the picture, right? And it will show you. And then it's not on the picture. And then right here, I had to read. They made me read. I have to read. And you guys know I don't like to read instructions. I hate reading instructions. But it says here at the bottom, stow these supplies in the neck compartment of your pouch. That's not fair. Come on, guys. It is a perfect fit, though. All right. So that's everything in like kind of the base level here. Coming next, a tourniquet and the supplies needed to complete your vehicle kit. So that's what's coming next. But so this is going to zip up. Notice I said it is going to zip up, so you know, don't screw with me here. Kit. We still have 2 pro level items. Let's just secure this guy. Okay. And we have these to go in the car directly. The first pro item is the Blaze Extinguisher. Ideal for tactical fire suppression situations. It allows the can to function in any angle, even upside down. However, our tactical situation is our car. And this is a 14.11 ounce. That's an interesting size. 14.11 ounces. I wonder how they came up with that. I'm sure there's a reason behind that. 14.11 ounces. Not 14 ounces. Not 14 and a half. Not 15, but 14. Oh, because it's 400 grams. That's okay. Interesting. Suppresses flames, cools surfaces, non-toxic, non-corrosive, easy to use, easy cleanup. And it looks like bear spray. And it works upside down. So, yeah. Fire extinguisher in your car. Again, there's things in the car that can catch on fire, or you might be on the scene to rescue someone else. I always look at everything as in I'm going to rescue somebody else. And thinking of having to take care of it myself is always an afterthought. And that's just my mode of thought because of my history in life and what I've done and everything, which is kind of weird and funny. But having this in your car could be super important one day. You never know what could happen. Not at all. So this is excellent, and I would love to have this in the car, just in case. And you know, do you know that they used to make us in the military every year you had to take fire extinguisher training, but not with a real fire extinguisher. It was an online computer-based course. You had to just basically click through the. Oh, so stupid. Yeah, you had to do that. So, pro item number 1. And then pro item number 2, the Molly vehicle panel. Now, we've gotten these before, these Molly vehicle panels, in both Barrel and Blade and Battle Box. And I have not been a fan of them, because I was just like, when am I ever going to use these things? What is the point? But now, there is a point. And I respect it coming in this box, because I have this new tactical vehicle trauma kit, and this directly relates, and I will use it now. I actually gave the old ones to Dave, but this one here, I actually have a direct use for it, and I will use it because this is exactly the kind of thing that I could use it for. So I'm not. You guys know that while I have a real love-hate relationship with Battle Box, and I still really do. I know Barrel and Blade, we've been kind of like, what's going on with them lately? But I still really like Barrel and Blade. So, you know, it's not like me just not liking it because of the box it came in. I really respect it with this because it directly relates to what we've got. You know what I mean? And I have a direct use for it now. So this is perfect for this. To keep it handy and accessible at all times, and that's cool. So I will absolutely use this to get this, you know, mounted up once we're done building it, you know, because I don't want to have to put it in the car and then take it out. So once we've only got one more box for this, don't we? Yeah, we do. So phase 2, there's one more box for the vehicle kit, and then I'll put it in. And then phase 3 is EDC, and I cannot wait for the EDC box. I'm so excited for that. So here we go with our Phase 2, Box 2, Box 5 overall from Medic Box. I'm still enjoying it. Are you guys still enjoying seeing the, all the Medic Box stuff? The EDC box should be awesome for us on this channel and everything we do. I'm really excited. So what are you guys thinking so far? Are you still enjoying this box as much as, other things? I am. I hope you guys are. So let me know what you think. If you guys, I should have said this before. If you guys have any cool war stories about, medical stuff out in the field, first aid, or if you were the subject of and you had cool stuff done to you that you want to share with us, please do. Let's talk about that. But overall, thanks for spending some more of your precious time with me, starting the year off. I really appreciate it. Remember that you guys are absolutely awesome, and I appreciate every single one of you. I genuinely do. And I'll be back again real soon.